This is the session about the curricular vitae writing, which is required for the public health careers. So today we have Dr. Sudarshan with us, who has previously served as a consultant with ICMR, WHO, and Ministry of Health and Family Welfare, and currently designated partner and CEO of the One Public Health LLP. His experience across the research, policy, and program implementation provides you valuable insight on this. So, for today's session, we are basically going to understand the structure of an effective public health CV as well as identify the key sections and the appropriate formatting. We are going to recognize the common mistake which are occur in the CVs. So we hope you this session will be equips you with the practical strategies to strengthen your CV. With that, I invite Dr. Sudarshan to begin with the session.
Hi Vaishnavi, thank you for the lovely introduction. I just want to wait for a few more minutes as people are just joining in. We'll wait just for just 3 more minutes. I request all the participants' patience. Thank you so much for joining. Yeah, I request Dr. Deepra Das to please mute your audio. Hi, hi, good evening, everyone. I hope I'm audible. I'm audible, right?
Yes, sir, you are audible.
Yeah.
Yes, sir, you are.
Yes,
So,
sir.
good evening,
Audible.
everyone. Yeah. So, good evening. Great to meet you all in this evening, and I hope all of you are aware what today's session is about. It's about building a powerful CV for public health professionals, and I'm Dr. Sudarshan. As Vaishnavi gracefully introduced me, I am a public health professional. I've been in this field for 6+ years. I've worked across government consulting in ICMR, WHO, and Ministry of Health, and I've been across several jobs. So that makes me, a very, serious candidate to take this topic today. And I'm also the designated partner and CEO of One Public Health LLP. One Public Health LLP is a company that is in the process of simplifying public health for all professionals across the spectrum. And you can get to know more about us at onepublichealth.com. So, what are the objectives for the day? So, we are here today to talk about two things: how to position yourself as a public health professional for your dream role, and how to document it professionally in your curriculum vitae. So, the target audience for today's session are students who are in MPH or master's or bachelor degree students who are pursuing public health or trying to build a career in public health, and early career professionals in public health who are still trying to break into their dream role. Why does your CV matter? Because it is the first impression. Like, so you and I may not be familiar, like I'm talking to you right now. Similarly, but I do not know who you are, or I do not know what is your experience, what is your skill set. Similarly, whenever you apply for a role, unless you clearly define what you can do, what you have done in your past, nobody will really know if you are suitable for the role or not. So unless you document all of your qualifications and experience in the most professional and suitable way, nobody will really understand that if you're the most suitable candidate for the role. So that's why it matters. And so I just want to also in between say something that I want the session to be a bit more, interactive. So beach may I might ask one of you to just pop in and answer some questions. So please free to pop in at any point in time. Do not hesitate. So again, like I said, why is this important? Because unless we give, like everybody here is here to make money, is here to do a job. Although we are passionate at it, it is our bread and butter as well. To get a dream role, we need to present ourselves and our experience, our education in such a way that the HR or the program officer for that particular role will be convinced that you're the right person, and they will shortlist you for the next step. So, unless you have a professional and a well formatted CV, the application is more or less meaningless. So that's why it's very important to have a professional CV. It also helps you show clarity of career direction, and it also reflects whom you are in your professional identity. It helps you develop a niche, a proper profile, and it helps you stand out in the crowd because there are a lot of people applying for the same role. You are not the only person, and only your CV helps you stand out before your interview, obviously. So there are several common mistakes that people do in a CV. One, they make a generic CV, like, the chat GPT and so many AI apps are out there, and you just say, okay, this is me, I have done this and this, please make a CV for me. And a lot of people do make CVs that way nowadays, and it's so generic. It is just a common bunch of words that have no real meaning. It is not even personalized towards you. It is not personalized towards your dreams and ambitions, and it is not even personalized towards the job you're applying for. And that is one of the biggest mistakes people can do while developing a CV. And people, a lot of times, they just say, or they just write in their CVs what they have done, or what their education is, what their qualifications are, what their experience is, without really giving detailed detail of what impact they have created in their jobs. Because unless you have created an impact, just doing the daily chores every single day may not really make you stand out in the crowd. Like, you can go and come back from your job, but that doesn't mean you have done anything in particular that will definitely make someone excited to hire you. So what you have done in your role that actually made a significant impact, that has to be clearly specified in your CV as well. And a lot of people format it very poorly. Like, they may have all the details there, but it may not be in an order that people can just immediately catch when they are looking through your CV. Just remember, hundreds of people are applying for that role, and when they might have to browse through in seconds or minutes, and unless it is formatted in the right way, people just might miss the important details of your CV. So it is always important that it is formatted in the best way possible. And also, while you are talking about your impacts or achievements, it has to be in a way that it is measurable. Unless it is measurable, like, okay, I have done these many trainings, or I have done this much impact, that this changed so many lives. Unless it's measurable, there's no way anybody can compare you to the other person and say, okay, this person is better than the other person. This person has done at least 5x number of trainings as the other person within the same period of time. This person has caused so much impact than the other person within the same period of time. So unless you have certain measurable uh, metric uh, that is associated with your impact, they will nobody will be able to differentiate your CV from the other person. And also, sometimes it might lack a clear career focus. Like I said, a generic CV with no real clear direction of what your actual experience is, and what is the direction of your professional journey, might really not excite any HR or a program officer to really hire you. And sometimes it can be way too extensive. A lot of people have done a lot of work, like, especially may not be early career professionals, but when you are in your mid career stage or in your late career stage, and you're still looking for a career change, sometimes you would have done a lot of work, and you just don't know how to prioritize that work that you have done for that specific role. And you might have a very lengthy CV of 10 pages or 15 pages, and nobody really has time to read that much. So what are these recruiters actually looking for? No, as far as my experience goes, they just want the right person for that right job. So if for a particular type of job, they might be looking for the person who might have the right technical skills for it, who might be able to make the most amount of impact within that particular duration where he might be contracted for. He Some people in public health might be looking for field experiences, because a lot of roles require a lot of travel and require a lot of community work, a lot of uh, direct interaction with the community, and program implementation experiences. And certain roles might require you to have a lot of research and analytical ability. And other roles might need you require you to have good communication skills, and also ability to work in a team. sometimes requires you to have coordination and managerial experiences as well. So these are all the various skills and kind of experiences that a recruiter might be looking for in public health. So you might need to know how to position yourself and position your experiences and your qualifications in the right way for that right role. So what is the right public health CV structure? Now, everybody knows contact details. Yeah. So everybody knows there should be contact details, because if you're sending out a CV, if they cannot contact you back, there's no use in it. So you need contact information. You need a professional summary describing who you are in the shortest possible and crispiest way, but also elaborate enough to actually describe whom you are, what you have done, and how you fit this role that you're looking for. You need to describe all of your education experiences and work experiences, research and publication, because public health, and research are intertwined in a lot of ways, and they go hand in hand. The skills and certifications, awards and achievements, and the right references. So I'll start with how to script the right summary. So let's start with the right contact information. So contact information is usually, like, everybody knows you need to have the mail and the phone numbers. But beyond that, how can you also add value even within this contact information and not just keep it bland? So how can you add value? By adding maybe your professional social media links like LinkedIn. If you are someone who has actively updated your LinkedIn, which I highly recommend, is very important in this day and age, for those who are seeking public health roles, to have an active LinkedIn profile and an updated LinkedIn profile where they have clearly described all their educations and experiences. And also, if you can, it also gives you a space to keep updating your day-to-day activities and your achievements and awards through your profile as well. So that is a good way to showcase, or just make yourself be more visible. Then you can also list your research profiles. The usual research profiles are Google Scholar, ResearchGate. Even your ORCID profiles can be listed there. Then if you have a website or company profile where they have described your some people have their own personal website where they are describing their professional journey, documenting their professional journey, their achievements and awards, and that could be linked there. Or it could also, you could also link your company profile if they have listed your name, your your photos, or they have linked your job descriptions. You can use all those links in their contact information as well. So writing a strong summary, so this is one of the most important things in a CV. So when people are looking at your CV, they will just judge you, because they will judge you with your summary, because most people don't really have that much time to read in depth, especially if they have to surf through hundreds of thousands of profile. So they might initially shortlist based on the summary, and then they might again further shortlist uh, while reading the CV in depth. So having a good, strong, and specific summary catered to that particular job is very, very important. Now, what do I mean by that? So first you have to keep it short. That's the whole point of a summary. You cannot keep it like two paragraph, three paragraphs that are like like a whole novel. Then the point of a summary just disappears. It has to be short. It has to describe the domain experience relevant to the job description. For example, if you are applying for a role as a program manager, or if you are applying for a role in a research project, You might have to script your your education, your experience, your skill sets, and your achievements in a way that will be suited for that particular role. It is always recommended to script your CV every time to cater to that particular job and the description which the job seeks. So you might not always have all the skill sets and all the experiences that a particular job requires, but you might have some of them and you might have a lot of them. And you might have to highlight what are those skill sets and what are those experience that actually aligns with the job descriptions that the HR has actually developed. So that catches the eye of the HR individual who initially usually screens these CVs at the first point in time. So and so that is highly recommended. So you will have to mention your career interest which aligns with the job you're applying for. Like if you are someone who is looking for a role in non-communicable diseases and you have like a few domain interests, okay, and that particular job is actually a job that is relevant to a communicable disease domain. So writing multiple different domain areas, like I might have interest in diabetes or hypertension and whatever, and then I might have interest in HIV, which is what the job actually talks about or requires. Then you elaborating on all those other interests may not be really useful for this particular job. You might have to focus on what you're actually applying for. You might say, okay, I am actually interested towards having a career built towards this direction as a program officer in HIV or in reproductive health or infectious diseases that are focused on sexually transmitted diseases. So that is how you have to structure your career interest while you are also describing your summary that should be focused towards the job you're applying for. And you have to also mention achievements or awards that make you stand out even within the same summary. You might have gotten an award for having the best poster in an HIV related competition that talks about HIV awareness. You can also just add it there. I got the award for this best poster for this competition that talks about HIV awareness. So and you just don't use a lot of generic statements that have no relevance to that job. It doesn't matter because again it's a summary and it has to be short. So I just want to ask somebody, just one person, to just open their mic and give me a brief summary about them. So I want to understand, I mean, like a couple of people. Just start with someone and then the other person can start. So please. So I want to know how much you guys are listening and what you have understood. Please, anybody can just. Do I have to call out names or? So Arjun Prakash, can you just give a brief summary about you?
Hello.
Yeah, yeah, please.
Hi. Good evening, sir.
Good evening.
Actually, I am currently a student, so it would be like that. So, my summary would be like that. Ki I am currently a Masters of Public Health student. Uh, wait.
Okay, yeah, think that you are applying for a role in TB as a TB program officer in an NGO. Uh, okay,
Yes, sir.
in Bihar, for example. Just try to
Yes, sir.
script and align with those experiences. Just make a summary around that.
A Masters of Public Health student.
Hmm.
Currently, with a strong foundation in epidemiology, biostats, and policy research, etc. So, trained in the analyzing population level data,
Hmm.
has some expert, has done some programs in the नहीं, programs तो नहीं किए. has some experience while dealing with TB patients
Hmm.
and experience in secondary research and program implementation and interpretation of the public health carriers aligned with the tuberculosis national programs.
Yeah, yeah, this is a good summary, and yeah, you've understood the gist of it. Thank you. And can, I will call upon another person. Uh, Dr. Isha Joshi, please. Hi, Dr. Isha Joshi. Am I audible? Or Harita? Harita, can you give a brief summary?
Hello, sir. Good evening.
Good evening. Yeah, think that you are applying for a role as in a research project associated with hypertension control program, IHSC, in somewhere in Telangana, for example.
Okay, sir. Budding public health professional with strong skills in non-communicable diseases, focusing on hypertension and cardiovascular diseases. And my UG background is also related to cardiovascular technology, where I can implement more preventive ideas and also public health policies and research oriented to the cardiovascular diseases and hypertension.
Wow, that is really good, specific, and very catered to the role. Do you have any awards or something that might be relevant to this, uh, to the job description?
I have also got award regarding the healthy cooking related to cardiovascular diseases from the district commissioner from Coimbatore.
So that's yeah. So that's also very relevant. So yeah, thank you so much. So is there anyone else who would like to volunteer and give their summary? If nobody else is interested, then I will move to the next topic.
Sir, what about the fresher one?
Yeah, please. Okay, you're a fresher.
Yeah.
That is fine. I'll just give you a scenario. You can try scripting based on, like, even if you're a fresher, for example, you are
So,
doing a thesis, right? So you
yes, sir.
also have
Actually,
a,
I have, sorry. Actually, I have experience in hospital industry and I'm working in the infection control department.
so that is great. So there must always have, you must always have something that is relevant to whatever role that is being asked for, because you are doing a master's, you have certain skill sets, and you probably have for, because you are doing a master's, you have certain skill sets, and you probably have you, like you said, you have work experience as well. So there will always be something that is aligned with whatever is being asked. So like I said, if there is somebody who is asking for a quality professional in an hospital, even that is a relevant profession after MPH, or sometimes. So how would you script for a quality professional role? Script your summary.
Like, um like I have experience in infectious control diseases and I do all the surveillance, and um, I do NABH audits.
Hmm.
So
So you have
I think
experience already in that. And do you have any awards that you have gotten around that? Have you done any workshops or certifications which you can briefly mention?
same. Actually, I have a certification in infection control diseases from Medanta and from Gangaram Hospital. It's in Delhi.
So that's great. So, like I said, this is how you script your summary. So, relevant to that particular role, just keep it short, but keep it very specific and focus to whatever you're applying for. And thank you.
Okay.
And Dr.
Thank you, sir.
Thank you. Dr. Ravikant, please.
Good evening, sir. Dr. Ravikant here.
Yeah, please. So, do you want a scenario? Hello?
Uh, yes, I want scenario. Yes.
So, yeah, sure.
Yeah, sir.
You can consider you are applying for a role in as a cardiovascular preventive health program officer. Uh, okay, in a community setting in Gujarat for an NGO. So, yeah, just try to summarize your yeah your CV.
Yeah. Yes. Sir, I'm pursuing my Master of Public Health course.
Hmm.
So I have already worked on various projects. Like recently, I have worked on diet and biomarker survey of India by the uh, THSTI CDSA, that is the wing of Ministry of Science and Technology.
Hmm.
And I have also experience of community work, community setting in a tribal area of Maharashtra, where I
Hmm.
worked as a, PMJY, MJPJY coordinator and
Hmm.
hospital administrator too. Also
Sure.
worked on various projects.
Okay, that's great. And you might also have to link some any awards or something that might be relevant to it. But at the same time, when you are describing your experiences, you might have to keep it within 1 or 2 lines. Just you don't have to elaborate, but briefly describe. Like for example, like how I said, like I have worked in multiple areas and multiple projects in different organizations. So I don't have to, while making a summary, you don't have to describe each and every single job that you have taken. You just have to find a common terminology that will fit everything. For example, I have 6 years of experience in government consulting across research organizations, both national and international research organizations, uh, both with across communicable and non-communicable disease areas. So this is just one line, but it describes all of the roles that I've had over the years. So that's how you present yourself in a summary. You get it? Hello? Yeah, I'm audible, right?
Yes, sir.
Yeah. Okay. Yeah. Thank you, Dr. Ravika. Now we'll move to the next topic, and
Yes, sir. Yes.
so we'll go to education now. So education, usually you will have to, the temporality should be from the highest to least. What do you mean by highest? Highest is obviously your master's is one step higher than your bachelor's, and obviously a PhD is one step higher. A doctoral degree program of any sort is one step higher than your master's. So you always script it in that way. You start from the highest, then to the lowest, and you can also mention any relevant diplomas and fellowships as well. So similarly, diplomas and fellowship, if it's a postgraduate fellowship or a postgraduate diploma, it always precedes or precedes your, proceeds after your bachelor's. And you also have to mention the university along with the institute where you have obtained your degree or diploma from, and you also have to mention the duration and the period of study from when to when, the years. So a lot of people do the mistakes of writing extensive fellowships and workshops in the education section, which may not be required here. I would rather prefer they be slotted in the skills section, because one, they can be very extensive and they might take the importance away from your education, which you have worked for so many years to obtain. And so always slot the certificates and workshops in the skills section. And so that is more or less self-explanatory. So the experience section. Now this is one of the most important parts of it. So you always have to be very clear, specific, and also uh, it has to be quite detailed, the experience section. And here also the temporality should be from the latest to the oldest. So it has to start with whatever you are doing recently or currently doing, to whatever you have done in the past. So in that order. So you describe the role, responsibility, and the impact created during the period you worked as well. So you don't just say, I went to work, I did this role, I did field implementation, I did that. You also talk about what kind of impact you have created while you were doing that role. What are the challenges that you faced and you came across, or you which are quite different from the rest, and you were able to pull it off in spite of those challenges. So all the sections, obviously it has to be detailed. At the same time, it cannot be too elaborate as well. Keep that in mind as well. So if you have like 4 jobs where you have worked, just ensure that each job has 4 5 lines, and it talks about all the projects, and it also talks about your roles and responsibility. It also talks about what impact you have created, and also try and use a metric for whatever impact that you're talking about, or whatever achievements that you have done there. For example, if you are someone whose responsibility was to train, arshas, talk about the number of trainings that you have done during that period, and the extent, that nature of trainings that you had done, and the type of the impact that you think those trainings had achieved, or help achieve over that period, and or will achieve even after you are away from the role. So you can script your roles and responsibility and impact in that way, and always try to have some metric that other people can compare against. Like if you're someone who has done this and you have done this many times, then they can actually compare you against the next person, so that they can shortlist you more than the other person. So there should be a metric as well. And you can also show leadership and coordination experiences. If you had certain if you had guided many folks while you were working there, you can always slot it as coordination experience. If you had to work across multiple stakeholders and multiple sites in a research projects, you can always slot that under coordination experience. So if you had a few people who were reporting to you, you can show it as leadership experience. And all of this adds to your CV as well. So while we are making a CV, we might forget these small details. We might think they may not have meaning, but they might add a lot of value to your CV. And it is always important to think over each and every detail, and try to understand what the job requirements are. Read the job description first few times, understand what and every single skill that they might be looking for, and what type of role it is, and then try to not miss out any detail from your experiences that might add value to that particular position you're applying for. Like I said, you must quantify your work. You might have worked in a place like, you might have worked as a state program officer, work for a large state, and someone might have worked as a state program officer for as well in a different state, but you might have dealt with population that is three times in number. So and that would be a very useful information that shows that you have the kind of hold in knowledge, you have the kind of hold in coordination, that you are uh, able to communicate, and you are able to tackle such a huge population. So that is important as well. The coverage of population, the number of services done, the number of facilities handled, the number of trainings conducted, and the amount of impact that you have created over time. So if you are someone who had handled the portfolio of maternal and child health, and over the period that you were in your district, if the maternal deaths were previously, they might have been like 1,000 per lakh population, over the duration of your stay, if they had become 600 per lakh population, then you have done a great deal of work there. And don't miss out on these tiny details, and those are directly and indirectly a testament to the work that you have done there. So it is teamwork. You are part of it. And it may not be just that your work, but it is something that you have contributed to. So you also have to think about impact in that scale and range, and try to incorporate it in your CV. So, and you might, so like while you are reading the description of that particular role, they might have asked, like, they might have asked that they are looking for a person who has good analysis skill. They might be looking for someone who has experience in dealing with data, or something like that. And you might have used it in certain parts of your roles in some point. So you can gently just touch upon, like, I have used R to analyze data to bring to develop this report, which actually led to this impact. So you might script it gently, just incorporate those skills that the HR might require for the role you're applying for into the experiences. I mean, if you have actually done it, you can just incorporate them into your experiences while scripting your CV. So what are the skills that might actually matter? Okay. So in public health, there are general skills that are always important across the domains, across the topics. Data analysis is an essential skill. Most of the time, it will be useful. And maybe the level of data analysis may vary depending upon the role that you're doing. Core statistical roles might require different expertise in analyzing data when compared to working in program implementation role. But there is hardly any role in public health that does not require you to do any sort of analysis. So you might always need at least basic data analytical skills, from Excel to like some basic softwares, whatever free or paid, whatever you can get access to. Any statistical analysis software will always be helpful. And Excel is one of the most important things at so even that should not be discarded. And field survey implementation is more or less useful in most of the jobs in public health. Program monitoring and evaluation over time is extremely important. And a lot of higher rules and national level rules, state level rules do have a lot of monitoring and evaluation experiences that are required. Communication and coordination in public health is mandatory, because it is a field where you have to work with different stakeholders and work with people from across different domains. And so communication and coordination skills are extremely important. So these are a bunch of technical and soft skills. And you might have them, you might not have them. You might be a fresher who may not have worked much in the field. But how can you develop these skills and improve your CV? You can attend certificates, you can do workshops, you can do internships. And all these are more or less like provided to everybody and are accessible to everyone. Workshops and certificates are free or even very cheap in multiple portals. And internships are free and can be accessible in the same place where you stay at near your home. So keep developing and building your CV towards the domain which you're looking for, and always keep looking at job descriptions in a particular area which you're interested in. So you will get an idea of what sort of skills and what sort of expertise these people require. So you should be able to build your CV to write a few things in that particular area. So even if you have not had a job yet, even if you are just a fresher who is looking for an opportunity, you will be able to strengthen your CV by adding these things that are accessible to everyone: internships, certificates, and workshops. And always try to, try to order them in the order of most relevance. Some certificates may not be very relevant to that particular job, while some certificates may be highly relevant. So putting the certificates that are not relevant, putting the 10 certificates that might not be relevant, and putting the certificate that is most relevant in the 15th uh, line or 20th line, nobody might come to that, order. They might discard your profile even before they reach there. So it is always important to uh, highlight in the order of most relevance when you are applying for a role. Research and publication. In public health, research and publications are always important. And in most roles, they are very relevant. Some, it is quite mandatory, while in some, it may add a lot of value to your CV. It just shows that you're a person who is academic and is willing to learn and wants to develop an expertise in a particular direction. If you're someone who is looking to develop an expertise in a particular area, it is always important you can try and do certain research projects in that particular direction. So if you're interested in communicable diseases, for example, and if you're trying to build your profile, if you're a fresher and you may not have worked in any research projects in communicable diseases as in infectious diseases, so how do you write research and publication? You can always work with a bunch of your friends, try to find a gap in a particular infectious disease area where there is not a lot of information on, and then you guys can sit together and develop a literature review. Even that could be published. So you don't have to do multi-centric projects initially, or you can start with just literature review. You can learn bit of systematic review and work with your friends and find gaps and develop some systematic review manuscripts. So all these will help add value to your CV and help add direction to your CV and help you build domain expertise in the direction you want to get a job in. So always keep looking out for these. So if you are someone who has already published a few papers, or you have developed certain manuscripts that are yet to be published, how do you add value to them? So more than just publications, you can also think about attending conferences, doing posters, doing presentations in these conferences, and try to win awards. And these awards can always add value to your CV as well. And what are awards and achievements in a CV? So there is always the research awards that I was talking about. You can go to conferences, you can present papers, you can present posters, and you can try and win awards for the best presentation or the best poster. What other awards exist? There are professional awards. These awards are given for the people who create the most impact for your job. And sometimes there will be call for awards in different types of roles. You just have to apply for them, and you have to get them. And then there are awards that are won in public health competitions. There are frequently a lot of competitions that are called for in different topics, where they ask you to make posters or presentations, or some other activity that will get you the best prize as well. There could be grants for certain projects. You can write grants along with your team, and if you get funded, those can be slotted under awards and achievements as well. So these are money or funds that are given for certain projects, like it could be research projects, it could be implementation projects, and there are several grants that are given from, like from Indian organizations like Tata Trust to WHO to ICMR, that are frequently calling for grants, that are frequently calling for people to write grants on certain topics. So if you get funded, that can be slotted under awards and achievements as well. There are fellowships. Then these fellowships are also available. They're on different topics by different international and national organizations. You have to keep looking out for them, and you have to keep applying for them in a particular domain which you're interested in. Again, having no clear focus, applying for everything and doing everything at random may not really add a lot of value to your CV in the long run. Maybe initially it might, but over time you need to develop a domain expertise, have a clear idea in the direction where you are going. It could be towards a particular topic in public health, like infectious diseases or non-communicable diseases or hypertension, within that hypertension, or maternal child health, or whatever. It could be a topic, or it could be a particular skill set, or it could be a particular role. Like the role could be like monitoring and evaluation, or it could be targeted towards just data analysis, or it could be targeted towards supervision. So, and so whatever domain or the area or the skill that you're interested in, you can develop expertise in that direction. That will give you a lot of value in public health, and it will give you a clear direction as well. And last but not least, your references. So if you're a fresher, and if you're just come out of your master's or your bachelor's in public health, and what type of references can you give? You can give the references of your research guide, your professor, your dean, your HOD, and whatnot. And if you must have done an internship during the period of the course, you can also give the reference of people you have worked under as interns. Then if you have some sort of work experience, you can also give the references of your reporting authority, whom you have worked under. It is always better to give at least one reference for all the experiences that you have had acquired over the time. And it is always better if it is the reporting officer rather than a co-worker you worked with, because that gives you a lot of authority, or that references will be more valued if they are the reporting officer for that role. I mean, or you could just limit it to 2 to 3 references in total. That would also be fine. But try to use the most updated contact information for your references. In case if a HR tries to contact one of your references and they are not, I mean, if none of the references seem to be, replying back, then that might not, do a lot of justice to your CV as well. That might come as a black dot. So just talk to references, try to add only people who might be willing to respond on your behalf and who are quite active, and get their most recent and updated contact information, and please add them to your CV whenever you're applying for the role, and try also to keep them relevant to that role that you're interested in as well. So if it is a role that is catered towards a monitoring and evaluation, for example, and those references have something to do with monitoring and evaluation, then the people working in your job might also know them. And so because public health is a small world, and that will give a lot of value to your CV as well. Like I said, it is always important to tailor your CV for your job. Take that time, develop a CV. So there could be quite a few domains that you're interested in. Okay, and it may not always be possible if for you to keep scripting your CV each time that you're applying for a role, because maybe you're applying for tens and hundreds of jobs in a period of time, and so you do not have time to do all that. But if there are 2 to 3 domains that you're interested in, you can always develop some CVs that are catered towards those domains that have the skill sets and experiences that are prioritized for those domains, at least two, three, and you can tag them in that way or name them in that way. So, for example, monitoring evaluation, CV, my name. You can save it like that and update it each time. And surveillance, your name, CV, or research, so your name, public health research, your name, CV, or communicable disease, your name, CV, like that. Program implementation, your name, CV. There might be two, three domains that you're interested in. You can always develop CVs for those domains and keep them updated, and you can use them for applying instead of using generic CV for all these domains that might not be of value. And so, for example, for program roles, it's better to have better to script them with experiences around field implementation and coordination. For research roles, it could be around analysis and publications. If you are looking for certain NGO roles that work alongside community, you can highlight your community engagement activities and your grant writing experiences. And if you are trying for academic roles, you can always talk about your teaching and research experience. These are examples how you can prioritize or focus your CV towards the roles that you're applying for. And how do you format your CV? Like I said, one of the mistakes people do while formatting CV is to keep them too extensive. Most people in this day and age do not have time to read a very lengthy CV. It may not be useful at all to keep that extensively lengthy. So just ideally just format it to 2 to 3 pages. So that is why it is important to prioritize for that particular role and keep highlighting skills and experiences that target towards the role, because you may not be able to add everything in detail. You use a clean layout so it's legible, it is easier to read, and you can also use bullet points over paragraphs because they are easier to read. You need to have a professional email as your contact, so ensure that it's not full and you're still contactable, and ensure there are no small spelling mistakes or any other errors that might look too obvious and might distract them from actually looking at your CV seriously. So how else can you add strength to your CV? Like I already said, even if you're a fresher, you can always do internships and volunteering. You can try to get some government program exposure. Like there is always certain NHM roles that are hiring for internships, or there you can always work with the local bodies that are always looking for volunteers. And you can always try join many workshops and certifications, and you can try and do local leadership activities to strengthen your CV. Then, how else can you improve your CV? You can join research projects. A lot of online portals are there where they actively engage students and early career professionals in a lot of research activities like systematic reviews. You can try to engage in them. You can volunteer, like I said. You try and develop a clear domain focus even at your early career stage, and you try and develop your skills and expertise towards that direction. Learn some data analysis tools. It doesn't always have to be paid data analysis tools. It could be just free data analysis tools as well. For example, R is free and it's very relevant. Excel is the most important, that cuts across domains. It can be used in any domain and it does most of your job. And it always keeps getting updated, so you always have to keep updating yourself on Excel as well. And Stata and SPSS are some of the other paid softwares. And Jamovi is also free. APInfo is free. You can learn some GIS softwares as well. Try and attend conferences and workshops, and try also become more than just a participant. Try to present during those conferences and workshop. Publish. Publishing is always important, and try to publish in a specific domain area so you can develop expertise in that domain area rather than publishing without any focus. Try to join internships that align with your interest, and again enroll in other competitions and awards that will highlight, get your CV highlighted towards the domain focus of your interest. And so I would like to end my presentation with that. So I want to ask if there are any questions that you might have. And Vaishnavi, can you moderate the Q&A?
Anyone has a question they can ask? If nobody has question, we can wind up the session.
So if no one has a question, I would like to ask Ms. Pa to, complete the session with a vote of thanks.
Yes, sir. Good afternoon, everyone. Good evening, everyone. As we conclude today's webinar, I would like to thank you, Dr. Sudharsan Vasudevan, for such an insightful and practical session on a CV writing. Your guidance was truly valuable for the participant. Thank you to my colleagues for their support, and a big thank you for all the participants for your active engagement in the webinar. And I would like to let you know that your participation certificate will be sent to your registered email IDs. With this, I will conclude the session. Thank you, and have a great day ahead.